The uterus is a muscular, pear-shaped organ where the embryo or fetus develops until birth. It is composed of the fundus, body, and isthmus. The cervix is the inferior third of the uterus and is approximately 2.5 to 3 centimeters long in adult non-pregnant women. The adult uterus is usually anteverted, tipped antero-posteriorly relative to the axis of the vagina, and antiflexed or bent anteriorly relative to the cervix. The ovaries are female gonads where the ova develop. They are also endocrine glands that produce reproductive hormones. A moderately filled bladder is generally necessary for optimal imaging. Patients should be instructed to hold their urine prior to the procedure. The patient should lie supine on the examination table. Place a sheet to cover the patient below the level of the pubic symphysis. The best approach to examine ovaries is with a transvaginal ultrasound probe, but for this exercise we will use a low-frequency curvilinear transducer. With the transducer marker pointing cephalad, obtain a mid-long axis view of the uterus. Keep in mind that the uterus may not lie exactly in the midline. It could be shifted toward the left or the right side. In this mid-long axis view, note the location of the bladder, uterus, cervix, vaginal stripe, and the pouch of Douglas. The pouch of Douglas is a potential space between the uterus and the rectum. It is not uncommon for a small amount of anechoic fluid to be seen in this region. However, the presence of fluid can also be a sign of pathology. Note the position of the uterus. Here the uterus is anteverted and antiflexed. Measure the length and antero-posterior dimension of the uterus as shown. The ovaries are difficult to visualize at times using the transabdominal approach. It may be helpful to scan obliquely to visualize the ovaries. Ovaries appear hypoechoic as compared to the surrounding structures. The follicles may be visible inside the parenchyma. The normal ovary measures about 3 centimeters in length and 1 centimeter in the antero-posterior dimension.